morning, everyone. First of all, I'd like to thank the organizers for inviting me for this talk. It's good to be back for the physical conferences, and the arrangements have been wonderful. I'm going to talk about a phase 3 comparison of high dose once daily thoracic radiotherapy with the standard twice daily thoracic radiotherapy in limited stage small cell lung cancers. It's a CLBG 30610, RTOG 0538. We all know that limited stage small cell cancer patients are very few. Majority of the patients are present in the advanced stage or they have a metastatic conditions, and there is no consensus for the dose of thoracic radiotherapy in the limited stage lung cancer. So if you talk about the Americans and the Indians, in US the standard practice for a limited stage small cell cancer is to go for a 1.5 gray into 2 fractions a day, going for a 45 gray in 30 fractions over a period of 3 weeks. Whereas in India we routinely practice 1.8 to 2 gray. And we treat over a period of 6 weeks, which is like 60 gray in 30 fractions. Some people do go for a 66 to 70 gray. So here the Americans wanted to have this comparison, to see if the single daily dose is equivalent to or better than the twice daily regimen. In the study, the eligible patients had a localized small cell lung cancer. The ECOG performance status was 0 to 2, and the regional lymph node involvement included everything except the contralateral hilar nodes or a supraclavicular nodes. Now this was the design of the study. Initially they had 3 arms. The first arm was 45 gray twice a day, 30 sittings. Second arm was a 61.2 gray over a period of 5 weeks, which was having a concomitant boost to the primary tumor or the nodes. And the third one was the 70 gray in 7 weeks, which was 35 fractions. The plan was to, it started in 2008, but in 2013, because of the complications like esophagitis, they had to stop the second arm. So then they only had 2 arms. The plan for the chemotherapy was P plus E for 4 cycles, followed by PCI, and the thoracic radiotherapy started with the first cycle of chemotherapy. And after 2013, they just divided the 2 arms only. So 45 gray twice daily fractions or 70 gray single daily fraction. And here again, the thoracic radiotherapy could have started with the first or with the second cycle of chemotherapy. Primary endpoints were overall survival. In the first arm, it was the number of patients were 313, whereas in the second arm, which was the study arm, was 325 patients. So coming to the results, the study was from 15th March 2008 to 1st December 2019. In 2013, they had stopped this, the middle arm. The median age was 63 years, ranging from 37 to 81. A majority of the patients were Caucasians, as the study was in US. 52% were females, and majority of the patients had an ECOG 0 to 1, which was 95%. The median follow-up of 2.84 years was for the surviving patients. The hematological and non-hematological toxicities were similar in both arms. When we talk about a non-hematological toxicity, we talk about, majority of the times we talk about esophagitis, which was more with the concomitant boost arm, so that arm was stopped. But otherwise, the both arms were having similar toxicities. Now let's see the overall survival and the median survival. So if you talk about a median survival, for the arm where there was a single daily radiotherapy, 70 gray in 35 fractions, it was 30.5 months. And if you compare it with the standard arm which they practice in US is 28.7 months, so which was almost equal. And if you talk about 2-year and a 4-year overall survival with a once a day radiotherapy was 56% and 39% respectively. And for the twice daily radiotherapy, it was 59% and 35% respectively. So you can see there was no much change in both the patterns. So after a median follow-up of 2.84 years, for surviving patients, once daily compared to twice daily did not result in significant difference in the overall survival. So what they concluded in the study was a high dose once daily thoracic radiotherapy with a 70 gray did not significantly improve the overall survival compared with the standard 45 gray twice daily. Nevertheless, favorable outcomes on the single daily arm provided the most robust evidence available supporting high dose once daily thoracic radiotherapy as an acceptable option in localized small cell lung cancer. Once daily radiotherapy also did not result in significant difference in progression-free survival. Outcome from this study was the largest conducted study on localized small cell lung cancer to date, and which will help us guide for the thoracic radiotherapy decisions for this group of patients. Now, if I talk about what we practice in India, so majority of the centers at our place practice single daily radiotherapy because our number of patients are huge. We don't have the time to go for a twice daily radiotherapy for majority of our patients. So practice here is a single daily radiotherapy. But maybe looking at this the Western data, because they have more lung cancer patients, we might in the future go for a twice daily radiotherapy for small cell lung cancers. Here they have done it in a different way. They have started with a twice daily and compared it with a single. So here I would like to end. Thank you so much.